In case you're just joining us for the first time, this is the Learn With Me series brought to you by Set 18 Oncology Nurses in Training, National Hospital, Abuja. I am Patience Ibaso Achiche. Today we will be separating fiction from facts, and we will be doing this by debunking the myths of cancer. I won't be doing it alone. I'm here in the hub with a friend and colleague of mine who has been in the cancer space for over 6 years. She is willing to share information. She's no other person but Nurse Hasna. Nurse Hasna, you're welcome to the hub.
Thank you.
Thank you for joining us. Can we meet you?
My name is Nurse Hasna Lasin, and it's my pleasure being with you here today.
Thank you for deciding to share information with the public today. Like I earlier said, our topic today is debunking the myths of cancer. But before we begin to debunk those myths, I'd like you to help us define what are myths and misconceptions.
Okay. Myths. When you say myths, myths are widely believed information, ideas shared by people which are false. And many people tend to fall for that and trust the idea, those informations
they hear. But why do you think people would trust an information that is not true?
People tend to believe information because of their source, as in case of myths, most of the myths they originate from our culture and some from our religion, which is believed, but they were not really true.
Okay, so regarding oncology, regarding cancer,
Yes.
I remember I shared a survey with an ex-school members of mine, and I was surprised about their responses. And the most of what I gathered, somebody said that she believed that cancer is contagious. I am as surprised as you are because I would like to know, is cancer contagious?
Cancer is not contagious. Cancer is not a communicable disease.
Well, if you say cancer is not a communicable disease, but there were other responses. Somebody said cancer is a death sentence.
That is another myth.
Okay.
Yes.
So if some people feel that once they are diagnosed with cancer, that is the end of their life. Is that true?
That is not true.
Okay.
Yes, there are cancer. Early detections of cancer give us a very good prognosis.
Okay.
Yes, there are early cancer detections, early screening that leads to cure. As in cervical cancer, any woman that is sexually active is advised to screen for cervical cancer. And once it is screened and it comes out positive, start treatment immediately in intervention of chemotherapy, radiotherapy. As in cervical cancer, to be specific, there are so many modernization of treatment model. There are treatment model goes with chemotherapy and radiotherapy concurrently.
Okay, as well as brachytherapy.
Yes.
Okay.
And it's curable.
Okay, that's beautiful. Wonderful information to hear. Another of the myths I heard of was the fact that some people feel that cancer is meant for only old people.
That is absurd.
It's absurd. I find it funny too. Cancer
affects all.
Okay, yeah.
Regardless of age, tribe, sex, or even race. Yes.
So what are those cancers that affect children, adults, as well as the older people?
Okay. We can say with age increases the risk of cancer. But it doesn't define cancer to older people or aged people. Okay. As in children, coming back to your question.
Yes, ma'am.
Mostly cancer in children, there are leukemias, nephroblastoma, which is cancer of the kidney or nephron. Cancer also affects teens. Yes. There are lymphomas widely in teens, myeloma widely in teens, and even adults. Yes, breast cancer, cervical cancer, colorectal cancer in adults. Yes, and then there is a research that mentioned 40% of cancer diagnoses majorly are from people aged 64 and above.
So that does not define the fact that cancer affects elderly people.
Yes.
Okay. So we are actually debunking that fact. Cancer does not affect only older people. Cancer cuts across various age groups, various tribes, various religion, various beliefs, various culture. And I would finally like to ask, herbal remedies. Most people believe that herbal remedies can cure cancer because they say our forefathers took herbs and they got better. So why can't we take herbs and get better? So do herbal remedies cure cancer?
Herbs alone cannot cure cancer.
Mm.
Yes, there are some certain herbs that can help to reduce the adverse side effects of cancer treatment.
Okay.
Yes. Mostly people at home tends to encourage people to take green vegetables. Yes, green leafy vegetables are advisable even in medicine
Mm.
to optimize level of immunity and blood level also.
Okay.
Yes.
So if someone takes something like turmeric, because I have really heard about turmeric, what does it do to the person, one who is diagnosed with cancer?
Okay. That should be a local research.
Yes.
Yes. It is said that turmeric helps to alleviate, or let me say, to decrease the adverse effects of chemotherapy
Okay.
in patient that comes down with nausea and vomiting, adverse emaciation, or let me say weight loss. It helps them to eat a lot, to
Okay.
increase their appetite.
Okay.
Yes.
Okay. Nurse Hasna, what are other myths you would like to share with the public and as well debunk to the public?
There are other myths people believe in, such as the use of smartphones, especially our mothers. Honestly, there is no proven any research that shows use of smartphones exposes one to cancer. In fact, the radiation being emitted by phone is close to nothing compared to ionizing radiation, so it has no cause for cancer.
Okay.
Thank you.
So how about hereditary?
Okay, hereditary. There are family with history of cancer, which it is believed by the society that their children or any other member of the family will also be a cancer patient, which is actually not completely true. Yes, but if an individual is from a family that has history of cancer, that person is at high risk of developing cancer. That's when we advise for screening. Yes, as an high risk individual, you should always go for screening.
Okay, how about people who feel that if they have a lump and it's not painful, then it's not cancer?
Any lump, any lump,
yeah,
needs to be checked.
Okay.
Yes.
So it doesn't necessarily mean that when there is no pain, there is no cancer.
Yes, it doesn't necessarily mean that.
So thank you so much, Nurse Hasna. So what are your final words for the public today about the myths of cancer?
Okay. Dear viewers, I want you to know that myth can destroy your sense of health. Don't allow myths to decide for you. Don't allow myths to make choices for you when it comes to your health. Get screens today. Encourage others to get screened also. People of high risk individual. High risk individual in cancer are people that had parents, close relatives that were diagnosed of cancer, had cancer or died of cancer. Those individuals are advised to please get screened regularly. Thank you.
Thank you so much, ma'am. Now over to you, viewers. Which of these myths have you heard of? Or which of these myths do you believe in? We'd like to hear that in the comment section. Until next time, this is the Preventive Health and Wellness Hub. Do well to join us every Monday and Thursday to learn something new about cancer. I am Patience Ibaso Achiche, your host here. Bye.